Physiotherapists use manual therapy, therapeutic exercise and rehabilitative approaches to restore, maintain and improve movement. So they work with a variety of different people, so it could be children, to the elderly, to people on intensive care, to helping people after they've had an operation or an injury.
I love the way that physiotherapy works. Yeah, you're autonomous, but mainly because you get to work across all departments within hospitals.
It's a modular degree and it leads to eligibility with the Chartered Society of Physiotherapists and the Health Professions Council.
So I attended the open day. We got to speak to the actual tutors and you could ask them a multitude of questions, and the tutors themselves were really friendly. And we also got to see the facilities, which was really good.
The University of Huddersfield has some fantastic facilities to offer yourself. Modern, up-to-date, well-working facilities.
So we have small student groups, and it just means that we have really good, efficient support mechanisms. All our students get personal tutor support and we get to know the students really well.
Staff here are absolutely brilliant. This is my first year and they can't do enough for you. They've got a fantastic support structure in place to actually assist you in everything that you need to do. Not just learning anatomy and physiology, but actually approaching your written work.
We get patients to come into the university, so the students get the opportunity to perhaps see some patients with neurological conditions or some musculoskeletal conditions. We actually have a clinic within the department at the university where the patients can come in, and again it just builds on some of that knowledge and some of those skills. We also have the opportunity for our first year students to go into the podiatry clinic at the University of Huddersfield. So before they actually get out on placement and see real patients, they've had the opportunity to sit with some third year podiatry students and just learn how to chat to patients.
The whole way that they put the course together is really good. In the first year, unlike a lot of universities, you get to actually go on clinical placement.
Placement was a really good experience because it's mainly about taking what you do in a classroom out into the actual world of work, and everything starts to fall into place and you really start to kind of realise your dream and realise what physiotherapy is all about.
You obviously need to have some experience so that you can prove that why you want to be a physio, but it's quality rather than quantity. I appreciate how difficult it is to get placements in an NHS hospital, so it's about thinking outside the box really. So perhaps ringing up your local hospice or your local old people's home, because physios and other healthcare professionals will be going in there as well, so that you can ask them questions if you see them, and also any evidence of working with vulnerable clients or having that sort of role within their extracurricular activities that show that they've got some transferable skills.
It's an absolutely fabulous course, but you really must be passionate about what you want to do. It's very difficult, very challenging, but it's so rewarding at the same time. It's really good.
We do interview all our students, so if you do meet the personal statement criteria, you will be offered an interview. The interviews are twofold. We have a group interview where you will do some group activities and that will be scored, and then you have an individual interview, and that's really your opportunity to sell yourself to us and ask us questions, because as much as we're choosing you, you've got to choose us as well, and so that's quite informal, but obviously we're looking for you to confirm whatever you've put on your personal statement.
And if you're going to come to the University of Huddersfield, learn from the best. It is the best in the country for physiotherapy.